Welcome, and thank you for participating in the 2022 Student Research Forum at the Chicago School of Professional Psychology. I'm Hevylla Terlau. I am a doctoral candidate in the Clinical Psychology program, currently a third year. My primary clinical concentration is adult neuropsychology, and today I will give you a brief overview regarding hot code empathy gaps and how it may influence clinical practice. This presentation was inspired by Lowenstein's article, which was published in 2005. Please refer to my references if you would like additional details. Before we begin, I wanted to focus on a case scenario, a fictitious patient, Will. He is an 85-year-old married Caucasian male with Lewy body dementia. He is displaying rapid cognitive deterioration. He is often confused, forgetful, delusional, and experiencing hallucinations. Additionally, he is displaying hypersexuality, including inappropriate behaviors towards his spouse and others. His wife, Mary, who is 80 years old, is Will's sole caretaker. She has her own set of medical and psychological concerns. She has a worsening cardiovascular condition and a long-term history of poor self-concept. With limited social and family support, she relies on Will's clinical team to make decisions regarding Will's care. So you may be thinking, what is empathy gap? Empathy gap is the influence that our affective state will have on the way we perceive situations. For instance, when someone is engaging in a hot to cold empathy gap, they may underestimate the intensity of their current affective state and the influence it is likely to have on their subsequent behaviors and choices. A good example would be someone that committed a crime of passion. In a moment of intense anger, this person may behave in a way that will have a strong impact long after their affective state returns to baseline. Now, when someone is not effectively aroused, they may experience what we call a cold to hot empathy gap. By underestimating their current behaviors and choices, they are likely to have difficulty seeing how it would impact their future self under emotional arousal. For instance, a teenager who today chooses to use tobacco products may be underestimating the impact of this decision and how it would impact their older self, an older self with a more fragile respiratory system. Now, due to empathy gaps, patients, caregivers, and clinicians may face difficulties making accurate and optimal decisions, such as failing to predict present and future risks and needs, because the person experiencing the empathy gap may also not be able to relate to others when they're not in the same affective state. For instance, a clinician aroused by a psychiatric emergency may decide to intervene using extreme measures, while they could have resolved the emergency with alternative options had they only paused and allowed some time for them to return to their affective baseline. Caregivers, for instance, burned by their role and daily distress may also be influenced by their affective state. They may make decisions that are life-altering for their loved ones. The caretaker may overestimate their current discomfort, therefore predicting that only a drastic decision would resolve the distress. As you see, awareness of hot and cold empathy gaps have direct implications in our daily interactions with others and with ourselves. I highly encourage you to further explore this concept and see how it may impact your daily personal and professional interactions. I hope you enjoyed this presentation. Feel free to reach out and ask any questions you may have. Have a great day.